actually Dan. I've got the wide shot. Yeah. Nah.
Everybody. Thank you to the more than 17,000 people who got tested overnight. But can I please stress that we do need that number to go higher, and can I please ask for people to come forward and get tested? It is so important that that occurs. Overnight we had 18 cases of community transmission. 9 of these were in the Avalon cluster and people were already in isolation, so they were close contacts and already in isolation. That's 9 cases. 6 of those related to the one case that we mentioned yesterday in the Inner West. The health experts are calling it the Croydon cluster. All 6 are members of the same family, extended family group, and we anticipate, because of the nature of that extended family's movements, that there will be more cases from that cluster. We want to thank the family members and the extended family for their cooperation. They've been absolutely cooperative and we're deeply grateful for that. But that Croydon cluster is now at 6, and we do appreciate there'll be additional cases reported tomorrow from that extended family group. And we also have 3 cases technically under investigation. One is linked to someone who was in the Northern Beaches, and the other 2 cases are in Wollongong, linked to those Wollongong cases. So as you see, we've seen the proliferation of cases outside the Northern Beaches overnight. And in particular, can I stress at this time how important it is, firstly, to come forward and get tested if you have the mildest symptoms. It was wonderful to see so many people come forward before Christmas in anticipation of visiting relatives and loved ones, and those numbers stayed high for a number of days. We need to get the testing rates higher to make sure we have confidence that we have eliminated all those additional chains of transmission that may exist out in the community. In particular, the Croydon cluster is of concern because there are no direct links at this stage. The health experts are working overtime with all extended family members who are involved to make sure that that cluster, all contact details, all venues and movements of that extended family are made apparent so that we can identify all the close contacts. In view of this, we have decided to make some further decisions regarding New Year's Eve. All households in Greater Sydney, that includes Wollongong, the Central Coast, Nepean and Blue Mountains, as well as the southern part of the Northern Beaches, so the southern zone of the Northern Beaches, will now be limited to 5 people per household on New Year's Eve. Obviously, in the Northern Beaches, you cannot welcome anybody to your home that's outside your zone. In Greater Sydney, we don't want anyone welcoming anyone to their home more than 5 people. And as I said, Greater Sydney includes Wollongong, Central Coast, Nepean, Blue Mountains in terms of the definitions we're using. Now, the Croydon cluster demonstrates what happens when there are larger family gatherings and how it only takes one person in that family gathering to give it to everybody else in the family. And we want to see a reduction of that. We don't want New Year's Eve to be the cause of a super spreader. Had circumstances been different, we may have acted differently, but we don't want New Year's Eve to be a situation where undetected cases, people who may be in the very early stages of the disease and not know they've got it, not know they're infectious, unintentionally give it to those closest to them and give it to those people in their household, but also people into their household. I mean, our preferred advice is that people just stay home for New Year's Eve, but if you must have people over, don't have more than 5. and please make sure you have adequate social distancing, good ventilation, all those things Dr. Chan and the health experts talk about. If you are going to welcome people into your home, make sure there's good social distancing, good hand sanitisation and good ventilation in your home. And it's always best to sit outside rather than inside. I appreciate the weather's not the best, but those arrangements are much safer. We also want to announce that we are restricting the number of outdoor gatherings from 50 people in Greater Sydney down to 30. So as we've said previously, it is safer to be outdoors, whether it's a picnic, a barbecue, but please maintain your social distancing, and please make sure that you at all times appreciate that there could be cases of the virus that we haven't captured, and certainly the Croydon cluster does give us concern, because until there's an established link between an existing case or an existing venue, or there's some crossover, that is of concern to us, which is why we've acted immediately on receipt of that advice to restrict further what happens on New Year's Eve. Our advice to the Northern Beaches community remains the same. We will be providing an update on the 2nd of January on what happens to the northern part of the Northern Beaches as well as the southern part of the Northern Beaches. And obviously we've already said to the northern part of the Northern Beaches, your stay-at-home rules will stay in place till the 9th of January, and that won't change. But for the southern part of the Northern Beaches, as you see today, the threat there is almost the same as the threat that exists in Greater Sydney. So we can anticipate that there'll be additional provision for those in the southern part of the Northern Beaches to be incorporated into what will happen in Greater Sydney. Our anticipation is that they will be part of what happens in Greater Sydney from the 3rd of January, but we won't confirm that until the 2nd, just to give people hope that they will be considered the same as what other parts of Sydney will be. However, again, we reserve our right to look at the data and to make sure there aren't any cases that we're concerned with that suddenly emerge in that part of the Northern Beaches. So if I can stress again, the strongest message to everybody across New South Wales, no matter where you are, is please limit your activity and your mobility. We appreciate it's a time of year when people feel they need to be with others, but please try and limit what you do. Please stay at home or make sure you are in a safe setting. If you're going to welcome people into your home, no more than 5 in Greater Sydney. And please make sure even then that you exhibit good COVID safe practices. If anybody has the mildest of symptoms, please get tested and stay at home until you're given the advice. And also please make sure that if anyone in your family has any symptoms, please ask them not to attend a gathering. Please ask them to stay at home. Please ask them to get a test and stay at home. And of course, a special message to those most vulnerable. If any of us are interacting with those most vulnerable in our community, those who are older or have another illness, we need to be extra COVID safe. Now, New South Wales always takes a precautionary response, and we are being very precautionary in this instance. We know outdoor settings are much safer than indoor settings. We know from the Croydon cluster that the greatest chance you have of getting the disease is from someone you know in a household setting or someone you know in a particular venue, and that's always the highest risk. We're also asking to make sure that if you do have a booking in an established restaurant or a hospitality venue, that you've already downloaded the Service New South Wales app to make it easy when you go in and out. We don't want crowds congregating or lining up, and that of course all businesses should have by now the Service New South Wales app well and truly on their system to make sure there's accuracy if we need to contact trace, and to make sure that it's easier for patrons when they're moving in and out of those venues. So again, just to be clear, for New Year's Eve and until further notice, and I stress not just for New Year's Eve but until further notice, everybody in Greater Sydney, Wollongong, the Central Coast, Nepean Blue Mountains area won't be able to have more than 5 people into their home, and that's until further notice. Also that outdoor gatherings will be reduced from 50 to 30, but can I stress it's still important not to have convergence of those outdoor venues. So outdoor gatherings, I should say. So even though we've said you can have an outdoor gathering of 30 with good social distancing, we don't want to see those groups of 30 converge, because that is a big health risk. So we're asking people to demonstrate common sense, and we're also asking people to respond to the information we've provided this morning. And again, I want to stress to the community of the Northern Beaches, thank you for your patience. So come the 2nd of January, we'll be able to give the southern part of the Northern Beaches, the southern zone, greater advice and confirmation of how they'll be provided advice moving forward, and the stay at home for the northern part of the Northern Beaches will be in place until the 9th of January. I'll now ask Dr. Chant to provide her update, and then we'll take any questions, but can I stress again the importance of getting tested? Dr. Chant will say it about 10 times as well in her messaging. We need people with the mildest of symptoms to come forward and get tested, and we thank in particular that one particular family member who came forward and got tested, and then we were able to identify the other cases, because it might take days, if ever, before you demonstrate those symptoms. It's really important, or the full-blown disease, it's really important to come forward as soon as you experience or feel the mildest of symptoms. Dr. Chant.
Thank you for coming up. So New South Wales recorded 18 new locally acquired cases of COVID to the 24 hours to 8 p.m. Of these, 9 are linked to the Avalon cluster. These were identified as close contacts or venue contacts. There were 6 cases, 3 adults and 3 children, all members of the same extended family, and they're all linked to the cluster in the Inner West, who we're now calling the Croydon cluster. One of these cases was first reported yesterday morning, as that case had come in very late the prior night. A further 3 members of the same, we are expecting that there will be additional cases linked to that cluster just because of the number of close contacts and the close household contact that a number of those contacts had over the period of Christmas and the preceding days. There were 3 further locally acquired cases under investigation. 2 cases are members of the same household, are from the Wollongong area, and 1 is from northern Sydney. So if I just talk about the Wollongong cases, there are now 2 cases in Wollongong, a woman in her 50s who was mentioned yesterday, and a woman in her 20s who is her household contact. The source is unknown, but the woman in her 50s had travelled to Sydney on the 15th and the 17th, visiting locations in the CBD on the 17th. So we have issued advice that people who ate indoors at the Buckley's Sydney on the Opera House Promenade between 7:39 and 9 p.m. on Thursday the 17th of December are asked to get tested immediately and isolate until you receive a negative result. What we're obviously looking at is whether someone who attended that restaurant was inadvertently infectious, unknowingly infectious at that time. That testing will help us identify that. And also, if this person was exposed at that venue, this will help us ensure that no one else is unknowingly infectious that ate at that venue. People who attended the movie The Prom, which was an open-air cinema at Lady Macquarie's Chair on the evening of the Thursday the 17th of December, are also asked to get tested immediately and isolate until you receive a negative result. There is a pop-up drive-through testing clinic which has been open at the Fig Tree Community Hall this morning at 11 Princess Highway, Fig Tree, and it will be operating from 8 a.m. to 8 p.m. every day until further notice. It is essential that we have very, very high testing rates around the Wollongong area. This case from Wollongong was in a number of venues and locations whilst infectious. Those details are on the New South Wales Government website, but we are concerned that there may have been inadvertent transmission at those settings, so it is critical that the community responds with those high testing rates. We have seen in the past that the Wollongong community responds, and I'm not expecting that. I'm expecting that this time. So thank you very much. Be patient. There are a number of testing clinics with extended hours, but we do urge you to get tested if you've got the most minor of symptoms, or the advice on the website indicates you should be tested. In terms of another cluster, I just wanted to clarify the patient transport drivers. So you may recall that we had reported earlier that there was 2 patient transport drivers that were infected. I'd indicated 1 didn't have a sequence that matched the cluster, the Avalon cluster, and 1 did. That led us to do some further forensic investigations with the laboratory, and what I can confirm today is that both those drivers acquired their infection through the transport of the infected patients, which was our initial hypothesis. There had been a lab error, contamination crossover event, which had led to that erroneous result, but the lab picked up on that and we thank the individual for also representing for another test, and we're able to run that test totally clear. So we are very clear that those patient transport drivers were exposed associated with the transport of the infectious patients. So that removes that as an unlinked case. In terms of aged care facilities, as a precaution, until we further understand the community transmission across broader Sydney, we are taking a very precautionary approach to aged care visitors. So until at least 11:59 on Wednesday, the 6th of January, we're asking that all residential aged care facilities exclude visitors except in those performing essential caring functions, and obviously for end of life. So please talk with your facility. We understand the impact that this has, but at the moment, until we understand the full scope of transmission, we do not want to inadvertently have any introductions into our aged care facilities. There are no restrictions on people from regional New South Wales visiting residents in regional facilities, but again, we're restricting people that have been in Greater Sydney from visiting residents in regional residential aged care facilities. Obviously, there are exceptions in those extenuating circumstances. I'd also like to indicate that the Liverpool sewage detection, we have had a detection in that sewage catchment. We are aware of cases in that catchment, but again, it is a reminder to all of the community in the Liverpool area, with the most minimum of symptoms, please come forward. I can't stress enough, as the Premier has indicated, the higher the rates of testing, the greater assurance we have that we are not missing ongoing trains of transmission. We may not be able to perfectly map out the transmission trains that have occurred before. We are doing our utmost to determine and detect and link all of those cases, but we may not be able to. But what is most important at the moment is that we break all current chains of transmission. And that is the basis for limiting the household transmission, the household visitor numbers. Households are the highest risk of transmission events. And so the safest thing you can do is limit your activities to your own household and minimise your interactions with other households at this time. Thank you.
Can I presume, Dr. Chant, that the transmissions of the one family, what is now the Croydon cluster, was Christmas Day?
No, there were a series of events that happened, and we're still trying to understand that. But there was probably a number of sequential gatherings which may have contributed to transmission, and it's too early until we've got further information about what were those transmission events. But you know, as you understand, close families often get together at this time of year with multiple other members of families on multiple days. People visit each other. It's a very social time, and I think we've warned the community about the risk associated with that. Clearly, it's premature to say that it was on one day, but we are investigating a number of lines of inquiry to understand that transmission event. But can I just thank the person who came forward in that cluster for testing? And I think this really highlights the point. Please get tested. Don't think it is the common cold. Don't think it's another cause. Don't think. At the moment, we really need you to go and get tested and remain isolated. And please don't even second guess yourself. If you're thinking you're a bit fatigued more than usual, if you think that you've got some symptoms, don't second guess those symptoms and say, oh, it must be because I was working late last night or working hard, or I haven't really got that sore throat, or I'll leave another few hours. Please go and get tested. We do not want you attending any events. Household type events, those conducted indoors, are the highest risk. And I suppose over the recent days, I've been highlighting the fact that many of our cases are actually household contacts. And that's why we often see a long tail to these outbreaks. Whilst those cases are generally occurring with people in isolation, it again highlights the Premier's point that you are most likely to catch COVID from people that are the closest to you, and clearly you spend the most time and the most close contact with those in your household.
How many people in total do you believe were in that Croydon home over the Christmas period?
We're not saying that there was any. So that Croydon Park group had a number of family gatherings over a number of days. So,
How many people in total do you think were there?
well, there wasn't an issue of on one day. I'm just saying over that period of time, there were about 34 close contacts identified, but not on the one day. So we have no indication there's any issues about not complying with the requirements. But you can imagine that if you've got an event on, you're catching up on the 20th of December and then you catch up with another group of your family on this day, you can see that people will have attended multiple events, and I think it reflects the time of year that this is a very social time where people spend a lot of time with their
I
families.
wasn't suggesting that they may have breached any restrictions, but more trying to, you seem to begin to say in your prelude that you're expecting at least 3 more cases.
I'm expecting that there will be, because of the nature of the contact and the fact that we have identified that there were infectious people at a number of these events, and some of the events went for over an hour at these family gatherings, and the household nature of it. So I'm just expecting that we will see cases. It is to be expected, and that's why we thank that group for cooperating so fully with our investigations, for assisting us with all the details of their exposure details, and they will be progressively put out on the web. A lot of that information was already put out yesterday. Any cases that are associated with that family will go through the same process and identify with them, even though we won't update the numbers until tomorrow, but we will continue to identify as soon as we have any information about venues that they might have been out and about whilst infectious.
The cases, the 6 cases that all tested positive, obviously all part of the same family group, but are they across a couple of households? How many
So they're
households?
across 3 households.
All the employment?
No, across the broader Greater Sydney, some in southwestern Sydney, some in the inner west area, and some in other parts of the city. So I think it just highlights the fact that we can't have this being seen as a Northern Beaches local government area issue. We've been very clear that we've been concerned about these seeding events that may have seeded other parts, and we've also been very clear that because we don't understand the full chain of transmission, how it actually got into the Northern Beaches, we are concerned there might be unrecognised spread. Sorry, so I think it just highlights the fact that we do need everyone across the state to be vigilant for symptoms and please get tested.
The case in Northern Sydney, is that still happening, or are you expecting more cases from that?
So the case in Northern Sydney that I referenced yesterday, we do believe that person has pretty clear links. That person did, for work purposes, go into the Northern Beaches for work and was present at a venue where there were positive cases. We're just doing further forensic look to see how they overlapped with infectious cases. But that was in the northern end of the Northern Beaches, in a time when we know there were infectious cases in that venue.
With the density of the housing in the Inner West, does that mean that it may have been spreading more quickly than, say, the Northern Beaches?
Clearly, it's more a function of the outdoor gathering and the size and the duration of time. So obviously for the COVID to spread, you need a person infectious. But the things that increase the transmission are the duration of time you spent. Indoor environments are greater than outdoor. If ventilation is poor and you've got doors and windows closed, again, that can add to the risk. But ultimately, households, we're very relaxed when we're in household settings. We're very close. We spend a lot of time, and if they're indoor spaces, there may be less social distancing, and there'll be more people in a smaller area, and so we will have that indoor risk of COVID spread being quite high. And I think we've been very clear that household gatherings are a particular risk, and we do see, even in cases, because we often get to cases and they've already infected their households, reflecting that infectiousness.
Dr. Chad, last time we had video of one of the 2 churches identified by New South Wales Health as at risk of person after person after person kissing the same Bible, which is exactly the same church where one of your COVID cases attended. Do you find that concerning, firstly? And secondly, is it a matter of selfishness where people make the individual decision, this is my religion, I have the right, this is my wedding, I have the right?
Look, I think I would just like to say that overall the community has had a great response. I can't acknowledge the fact that when we ask people to turn out for testing, they have done so. Even though I'm asking for more testing, I mean, 18,000 is not I think we've had about 17,000. That's not a number to be sniffed at, that those numbers have turned out. So overall, the public has been incredibly supportive. We have been working cooperatively with the religious leaders, and I acknowledge their important contribution. I've got to say, when the outbreak occurred in Avalon, they were the first to reach out to say how they can get the message out. So at this time, we will further communicate to religious groups about COVID-safe practices. We do urge churches to ensure that they keep solid records of everyone in a church. We've got the cap on church capacity and the 1 in 4. But again, very much messaging to their parishioners around COVID-safe practices, and please do not attend if you have the most minimal of symptoms.
A couple of hundred strangers kissing the same Bible.
So thank you for raising that. We'll follow up that with the religious leaders, and again, we've got guidance on churches for COVID safety, and we'll reach out to them. I think at this point in time, I want to acknowledge the cooperation of the churches. We did get the lists of the people that attended those churches. Our focus is contact tracing people at those churches. But again, everyone should be aware of how COVID transmits and take appropriate precautions.
There's been suggestions on the Wollongong case that perhaps that Wollongong person also worked in the Wollongong hospital. Do you have any information on that?
I don't have any information about that. I think we've been clear at the sites and venues that the person worked at, and we are investigating both the downstream, like where she was when infectious, because that's a risk to the community, but we also are doing some upstream testing to find out the source and connections.
Premier, could I ask a question about QR codes? The Service New South Wales QR codes are going to be compulsory for all businesses and venues from January 1. What happens if you're from another state or overseas and you might not have a Service New South Wales account, or that is off limits? How do those people check?
Oh, there's actually opportunities for that. We've actually catered for that. The New South Wales website, Service New South Wales website, has details around that. So we've assumed that people might be here from other states, people might be here who aren't residents of New South Wales, and there's opportunities for them to access that. So that's all through the website.
Premier, the tightening of restrictions has been announced today vis-a-vis New Year's Eve, and also the emergence of the Croydon cluster. Does that show that your Christmas strategy was a mistake?
No, what this demonstrates to us is that during a pandemic, you have to take decisions based on the science and the data, and that's exactly what we've done at every step of the way. And that's exactly what we will continue to do. It's always a balancing act of the health risk versus what restrictions you impose on the community, and every decision we've taken in New South Wales has been based on the health advice. Whenever the health advice changes, and in fact, Dr. Chant can attest, we respond very quickly. So as soon as any one of my team gets advice from Dr. Chant in relation to what should occur, we immediately consult and move forward, and that's exactly what we'll continue to do. That's what has stood New South Wales in good stead. But we do ask people to go over and beyond, because we can put all the restrictions we like in place, but if people choose not to do the right thing or exercise good common sense, that is a huge risk to all of us, and that's unfortunately sometimes what happens. We're deeply grateful for all those people who've been so cooperative with our health experts, going for hours at a time for interviews, going through all, essentially what they've done for the last several weeks, including all of their contacts and their family members. It's a big imposition. We're deeply grateful that people are going through that process with us, because it helps to have that information. But also, it's really important for businesses and organisations, for religious, for places of worship, for businesses to have good record keeping of who's been on their premises. You shouldn't be letting anybody in your premises unless you have their details, unless those details are accurate. And you yourself know, given what we've been talking about for months and months, what is COVID safe. We've explained what the main risks are. The highest likelihood of getting the virus is from a household contact from someone you know very well. That we know scientifically, the data, that's what the data tells us. And we also know that it's safer to gather outdoors. If you must gather indoors, limit the number of household contacts, limit the number of people coming from different households, limit your activity unless it's absolutely essential. We don't want super spreading events on New Year's Eve, and that's why we've kept the 5-person rule in place beyond New Year's Eve until we're confident that we have identified all strains of the transmission.
Is it reasonable for people to be disappointed that the government hasn't worked out how all this started by now?
That's up to them.
Given that you locked down Northern Beaches when there were so many cases, why not do a 10-day lockdown, say, in Greater Sydney now there are so many cases and we're at 150 cases really across
Well,
Sydney.
we don't feel that the health advice doesn't request that at this stage. The health advice is still such that we have a handle on current outbreak. I mean, obviously the Croydon cluster is concerning because there is no established link. All the other cases, there is some crossover with venues or regions that we've identified as a concern. And because of that concern, because of the Croydon cluster emerging, and that case, the first case actually came in, we reported yesterday, it was very late the night before, and given what's occurred during the day has prompted us to take this decision. So we've acted immediately, as we will. But we obviously, the data that we get is ongoing information to us, and if the health advice ever changes, I've demonstrated already my government is quick to act. We will change the settings in place, but we also at every stage rely on people to do the right thing as well. Common sense is important, following our advice is important. Even though the health orders allow you to do certain things, you've still got to make assessments to yourself as to what is safe and whether your vulnerable family members should be exposed, whether you have a symptom and should get tested and stay home and not participate in any gathering where you could expose yourself. And the worst thing any of us can do is unintentionally give the virus to those closest to us. And none of us want to see that happen, and that's why we've taken the action we have. I think I indicated yesterday and the day before that Greater Sydney is on high alert, and that's certainly magnified. But I also want to stress that especially as Dr. Chant has highlighted, we're in some cases at the tail end, we are going to see the numbers bounce around because as time progresses and people with the infection have gone home, they may have given it to their household contacts or close contacts. And as we've seen, some cases are emerging or symptoms are emerging very late in the isolation period, day 11 or 12. So it's really important to maintain that 14 days. And please, can I stress, we are relying on people following the health orders. We're also relying on people exercising their common sense and not putting themselves in a situation which makes them or their family member vulnerable. And no matter what great policies or health orders we have in place, you can't cover every single exceptional circumstance, and that's why common sense is so important. Of course, police will be out in force, our regulators will be out in force to make sure businesses are complying as well, but we can't guarantee that 100% of the time, 100% of the population is going to be doing the right thing.
Premier, a quick question for either you or Dr. Chan. I don't know who's more appropriate for this, but can people still gather in groups of 10 outdoors on the southern end?
No, it's all 5. Can I comment on that, on the outdoor gathering?
So
yeah.
the outdoor gathering there was a permit for the outdoor gatherings in the southern end to be for exercise and for recreation. What we're talking about is the visitor numbers to your house being limited for those days.
So you can't.
And that was.
I presume I'm being asked to ask this question.
Oh, the 10 stays in place.
We've
Sorry.
got shots of people on the beaches. Is that allowable to gather
So-
in groups of larger than 10 on the southern end?
So the idea is not greater than 10 in the southern beaches. So currently people are allowed in the northern end of the northern beaches to go out for recreation or exercise outside in groups of 5, and for the southern end they're able to do so for groups of 10. This is about outdoor recreation, it's about going to the playground, it's about going to the beach. Outdoor venues are much safer, and this is reflecting the fact that those individuals have access to a lot of outdoor environments for which they can enjoy safely and pose no threat to each other.
You've been able to stand up every day, both you and the Premier, and say we've linked it to the Avalon cluster every single day. Obviously, when you see the numbers coming through, that's a sense of relief. How did you feel when you realised now there is a second cluster? At the personal level, with the amount of detail and the work that contact tracers have been putting around the clock, that must hurt.
Well, I think that we were very open yesterday. You know, even though we were reporting the 3 locally acquired cases that had been in isolation for the full period at that press conference yesterday, we had just got information in around this cluster, and at that stage did not understand the scope. But obviously we understand that when you have one family member that's positive, when you start testing around them, given the nature of the gatherings that were occurring over that period, we anticipated that we would find cases. it was critical that we were looking for that index case and hoping at that stage that we would be able to find a link back to the Northern Beaches. That did not materialise. So clearly, I think the Premier and I are expressing the fact that we are concerned that this Croydon cluster at this moment, we have not found a link to the Northern Beaches, despite 24 hours of really intensive investigations. It's not to say we won't, but at this stage that is concerning. We are also doing genome sequencing because, as I said, with COVID, you've got to keep a very open mind, and we will be making sure that this is the same Avalon strain, that virus, and linked genetically to that cluster.
Will you be able to tell who's the first of those 34 contacts to have contracted the virus, and that will be able to chime in on?
That's correct. That's part of the investigation. So in terms of looking at it, what we often look at is what are the people that had the first onset of symptoms. That's a bit tricky because people do have variable incubation periods. We've talked to you about the fact that you can get the infection any time between 0 to 14 days since exposure, but we do tend to pick up in these events transmission earlier. We can then use serology as a bit of an indicator sometimes. So serology usually starts to come up 7 to 10 days. And so by people helping us with serological investigations, we can sometimes narrow the time frame. So we use multiple sources. All of them have some degrees of uncertainty associated with them. And that really highlights the fact that we may be pursuing lines of inquiry in relation to several members of the cluster. Even though we might have the earliest onset, they may well not have been, they may have been infectious before. So what I was trying to say is that, to give you a scope of the cluster, there are not 34 people infected. What we've announced is the 6. What we're saying is that we know that there was a lot of interactions, a lot of household gatherings between approximately around 34 close contacts associated with that. And again, can I express my great cooperation? We request people to urgently get tested. That gives us a sense of the scope and how many we're dealing with. The problem is, as you know, we're not going to be able to know the full number that impacted by the cluster until we wait that 14 days, because we know infectious people were at a number of those household-like gatherings that have occurred in the preceding period.
That 14-day period will take us past or into certainly the third test that's going to be held at the SCG. And yesterday we were here, the Premier was among many people hoping the Sydney test would still be held in Sydney. We got that announcement overnight. Is it still safe to do that with tens of thousands of people?
So just to clarify that once we have identified cases, we know their status going into isolation, and then they effectively isolate. So these contacts do not pose a risk of ongoing transmission, even if they develop disease in the next couple of days or 3 or 4 days, even if they develop disease at day 10, because they're isolating. What we're trying to do is check that there are no inadvertent transmission chains in the vicinity or unknown. So to be perfectly frank, these contacts are not the cause of the concern. It's because we don't know who has infected.
But given the nature of what the virus is doing now, we're seeing a second cluster emerge, a huge number of cases in comparison to yesterday's numbers today. Is it still safe to have the third test on with 50% capacity? Which was what I think your advice to the Premier had been.
We have certainly taken some additional steps to make sure that public transport masks are used. We're re-looking at some of the aspects of the mixing, but seated outdoor poses less risk than people perhaps gathering in households to look at the test. And so these are balancing, but we have got faith in the transport plan and the work that the Sydney Cricket Ground has done. But we are looking over the plans as we speak to ensure that we can strengthen all elements. But again, we're urging anyone who is unwell, do not attend. Check before you go to that test. Check the venue and make sure that you haven't been to any of those sites. And we will update the community on any additional information. I think the one message around COVID is it changes all the time. Just before coming to this press conference about whether there's any new information, we will get the information out to the community if there is anything that raises additional concerns.
So tickets are on sale. Should people from the southern part of the Northern Beaches, from the inner west of Sydney,
they're not.
Should they be buying tickets?
if they're not permitted to leave the
It's on January 7th. So.
January 7. So, look, I think there's a long time between now and January 7. As the Premier said, we'll be constructing advice to advise government on this on around the 2nd. We will announce what the settings are then. But the best thing the community can do to ensure that we get to COVID normalcy, whatever that looks like, as soon as possible, will be to present for testing. Do not go to any functions if you have the most minimal of symptoms. Isolate and get tested. Chains of transmission are occurring, and please everyone keep up to date with the New South Wales Government website. We will be loading a number of venues progressively through the day as the case interviews occur.
Premier, can I ask your thoughts on the test, Premier? You know, obviously good news last night, but bittersweet because of this.
Look, we're expecting, as Dr. Chan advises me and we advise the community, there's always what we call a tail. When you've had a large concentration of cases, you do expect during the process you're going to have those household contacts who are in isolation get the virus, and obviously that pushes up the numbers. I'm expecting the numbers to bounce around for several weeks. But what we don't want to see is new chains of transmission that we don't know about. Now, the best health advice to us is that 50% capacity of that venue in an outdoor setting is safer than being in a household in confined spaces. So outdoor settings, ticketed, seated, controlled events are deemed to be safer than having too many people within a household. So that is the best health advice provided to us, and in fact this morning we even tightened the COVID Safe Plan to make sure there's additional information, masks available for anyone catching public transport. So everything is being done in all aspects of the community to keep everybody safe. But the best advice we can give people is if you have any symptoms, get tested, stay home until otherwise advised, and make sure that you consider your own activity, your own vulnerability. But outdoor seated ticketed events, so long as they have a COVID Safe Plan and so long as the venue sticks to that plan and that the patrons, the people going to that venue, stick to that plan, is deemed to be safer than having a household gathering. And that's why the settings are what they are. The science and the data tells us the greatest chance you have of getting the virus is from somebody you know in a household setting or an indoor environment. And that is the best advice we have. Rely on.
Premier, what's your reaction to Sydney retaining the test match? I mean, you must be pleased. A lot of people working into the night to ensure.
Oh, look, of course, we're always pleased that we can host COVID safe plans in this environment, but it doesn't stop any of us being on high alert about all of our movements, about all of our activity. And as I said, we're expecting the numbers to bounce around a bit. And what gives us cause for concern is when there's an unlinked cluster or set of cases. Now, this morning Dr. Chant was able to eliminate a couple of those previously unlinked cases because the genomic sequencing has now established links, and that's good news. But whilst there's a cluster where there's household contacts, and as Dr. Chant said, that's the theory at this stage is that it happened at several events leading up to Christmas, so we have to be mindful of that as well. And we also have to be mindful of the fact that no matter what time of year it is, some extended families gather all the time. So even though Christmas is behind us and New Year's Eve is behind us, I know Orthodox Christmas is coming up on the 6th and the 7th, but outside of those special days, we know that families do tend to get together in multiple household configurations. We're asking for that not to occur. We're asking people to really think about their movements. We're asking everybody to think about their activity, and of course we'll continue to consider what happens. And as you know, during the course of the day, our genomic sequencing experts, our health experts, are always able to establish further information and further links. But until such time that we have those established links, we have to be extra cautious and take a precautionary response, which is what we're doing. And for us at this stage, the most concerning thing about the Croydon cluster is we haven't yet established a link. And if we do establish that, obviously our degree of comfort increases. But having said that, outside of that cluster, all the other cases identified today, 3 of which we'd already announced yesterday, part of the numbers today, have an established crossover or something where the health experts can establish that. But the concern for us is when you have a cluster that emerges where there isn't a link, because then we have question marks as to, well, what's the crossover point? How did that person who introduced the virus to their extended family get it. And that's really what our health experts will be working over time trying to identify.
Just on the safety, just on the
Pet Water today made some comments about that it's quite unfair, given there's cases in Greater Sydney, that it's quite unfair on the Northern Beaches to stay in lockdown. What do you make of those comments?
Oh, look, I think they're completely justified. I can appreciate the frustration people feel.